Now, Deputy President Paul Mashatile agreed to the 6-month supply demand and said it was not unreasonable. That's when he spoke to activists yesterday. Let's get to the latest on the story now. We're joined by Yvette, Raphael, who is the Executive Director at Advocacy for Prevention of HIV and AIDS. Yvette, thanks very much indeed for joining us. It's a great pleasure talking to you. But there does seem to be a disconnect, right, between what the Deputy President signed in that memorandum of demands and what the Health Minister says is possible in reality.
Yes, thank you so much, Michelle. And we are used to that as advocates and activists in South Africa. One minister would say something different, but we must remember that Paul Mashatile is the chairperson of the South African National AIDS Council. Him signing it and agreeing to it means it will happen. Dr. Motsoaledi will have to make it happen. So he has to rearrange his budgets to ensure that these become available. But what we also don't understand as activists is why would it be a burden when we're cutting off the number of visits by people to the clinic. So it shouldn't be a budget constraint as such. He just should arrange and plan properly with the people in his department to make it happen for people living with HIV. We want to see the demedicalization of some of these things. People living with HIV have been able to take their medication for a long time, some taking it for their meds for 3 months. Now it's time for us to change to ensure that people stay at work. We know when we go to these public clinics, Michelle, some people stay the whole day at the clinic, and that means a day of work. That means a day of your own resources. I just don't think Mr. Motsoaledi is thinking straight when he's complaining about this, which will be less burden for the healthcare system.
Yeah, absolutely. I mean, it might be perhaps more expensive to kick off initially, but then in the long term, as you say, I'll still be collecting the same amount of ARVs in a 6-month period. I'll just have it in advance. It also means that I have one less visit to the clinic in that 6-month period. The numbers add up in the long term. It's really just like for like.
Yes, it's in the long term, but also you must understand, if the Department of Health plans properly, they can buy in bulk, and which brings the cost down. It's really no rocket science. I think Dr. Motsoaledi just likes to be controversial, but it has to be done. We have to ensure that people living with HIV have as normal lives as possible, and which is staying away from the clinics, going every day, or not every day, but going every month or every 3 months. Now we are saying only twice a year, and this treatment will be given to those who are highly adherent, who have proven that they do take their treatments every 3 months. They go fetch it and they actually take it. So there is no excuse. Currently, myself and my organization, we welcome this, the decision, and as well as we applaud Mr. Paul Mashatile, who's the Deputy President of the country, President of SANEC, for making such a revolutionary decision for people living with HIV to have normal lives. Our space is not in the clinics. We don't have to sit in the clinics for a whole day unless Dr. Motsoaledi thinks that's okay.
Yeah, absolutely. And then, of course, when it comes down to our HIV and AIDS burden in South Africa, Yvette, this kind of initiative will go a long way to helping us reach that goal of ending AIDS as a public health threat by 2030. And, people often joke that 20 years ago was, in fact, not 1980. It was the year 2003. By the same token, 2030 is not some far-off goal in the future, decades away. It's in 6 years' time. So if we're going to reduce the burden of 150,000 new HIV infections, 50,000 AIDS-related deaths that we logged in South Africa in 2023, this is certainly one very, very effective way to do that.
Yes, definitely. And we know that when people are on the HIV treatment and medications, they are able to prevent them. They are able to not infect their partners. The U equals U program is going to be in effect here. What we are going to see is more people not getting infected with HIV who are in discordant couples when one person is HIV positive and one is negative. So we have to move with the times. There are many countries that are doing this, and there are even more countries that give yearly treatments to people living with HIV, because we are normal people. We are getting on with our lives. We have to rush in between meetings. Time to chill at the clinic for fun is no more there. People living with HIV are living normal lives, and they are contributing to the economies of their countries.
Certainly. Yvette, let me thank you for your time this afternoon. Certainly an incredibly important conversation, particularly as we build up to that 2030 deadline, ending AIDS as a public health threat in South Africa. Yvette Raphael is the Executive Director at Advocacy for Prevention of HIV and AIDS.